Right, so we got weekend review. We're going to do 3 tickers. We got Collegium Pharmaceutical, COLL. That's a member request. Another member request is NantHealth, NH. And then my pick for the weekend is Dynavax Technologies. Collegium is a bioreactor. NantHealth and Dynavax are both BioBoom. Now, Collegium, the question was, why are we not involved? What's the deal? Most of our other bioreactor names have hit their buy targets. Collegium is failing to hit, which is, I guess, bad for most of us. I still have a small position in it, but it seems to be holding up very well, despite the overall market just kind of rolling over. It did have its moment. I think it was May of this year. So they started weakening up in April, had a rough time through May, and has been holding up quite well. So why is it holding up well? Why is it even holding a premium at all? They are an opioid company. They have their flagship product. Let's go to their products. Zentampa. I can never say that one right. Zentamza. ER is a oxycodone, an extended release with abuse deterrent. So, as all these other companies are dealing with, hey, you guys were part of the opioid epidemic and partially responsible in some way. Collegium with their product is, I hate to say the solution, but maybe that might be the best way of saying it, because you still need oxycodone and various other opioids, because they still get through the brain-blood barrier very quickly, and they can essentially be prescribed for year-round 365 all-day use for people who have chronic pain, whereas like NSAIDs, and they can't be, because it hurts the gut, the stomach, the liver, the heart, kidneys. Obviously, because of the heart, the high blood pressure, the kidneys get beat up. So if they're going to be on those for long periods of time, they're going to have to take other drugs for hypertension and for their stomach. So unfortunately, you can't just keep pumping people full of NSAIDs. So opioids are still essentially the best choice for chronic pain relief. So that kind of leaves Collegium being one of the few companies out there that, I don't want to say are surviving, but maybe that might be true. Purdue's not doing so well, but they'll be one of the market leaders, and they're gaining market share, so it's happening. So that's probably why this ticker's holding up, is because people are bidding it up knowing that it's got a bright future, both in terms of their current drugs and the stuff they just required from BDSI. So there's that one. Belbuca. This is, I think it's an opioid, but in the buccal film. Chronic pain. Pretty sure it's a buccal film. Yep. So it's cheek. Buccal meaning inside. So you just take the film, it's stick in the cheek. So quick, it's extended release though, right? So that should, if it's gonna be in your cheek, it should probably have it should be fast acting, but extended release. I don't know if that really works, but I'll have to look into this one. This is one of the ones they just acquired from BDSI, so I'll have to read into that one. Nucynta, they got these guys a while ago. It's been holding up well. Again, another opioid. Extended release and immediate release formulations. So here's cellcoxib. So here we go. I don't know. Oral solution. Another BDSI. Long acting. So 24, 2 hours for up to 20 minutes. So this is for migraine. I don't know why we'll have to look into why the formulation's specific to migraine. One of the companies it's changed its name was Kitov, and they just fumbled their potential. They had Consensi. It's a combination of amlodipine, benzylate, and cellcoxib, and it made so much sense because the issue with cellcoxib is the blood pressure, and the amlodipine would alleviate that by taking them at the same time. So anybody who has, like, especially orthopedic, like anybody who has bad knees, hips, shoulders, whatever, you can take that at the same time. The amlodipine should at least offset the issues on the heart and the kidneys, the high blood pressure, which destroys kidneys. So they would do those two, and together in a combination, and the results from the clinical trials were great, but then they just fumbled who their commercial partner is. They should have gave it to Collegium. These guys know what they're doing. Simproic. So this is very nice. So they have this is the one of the major issues with opioids is the constipation. So their portfolio now is solid. Let's take a look at. Let's close these guys up real quick. Sorry. Let's take a look at their earnings, which I think this is why I loaded up. Yeah, so this is their earnings report. Let's see if I can find the press release real quick. We'll read the press release and then we'll go to the slides there in a second. So here's Q3, record revenue for the quarter. That's good. Getting some new renegotiations. Nice. It's doing share repurchases. 10 million. It's not much, but that's showing some. Excuse me, dry mouth. They at least care about the shareholders. And then let's see, full year guidance. They're updating that. Let's take a look here. Setting themselves up. That's nice to say. Strong finish for 22 with a setup for 2023. I hope so. Seamless integration. I think I would have to say that's true. I'll give them that. They really did a great job of going and finding a great acquisition target. They got it, and seems like everything they brought in makes sense. It's not like they have to really go out of their way to sell those products. Everything just works right with theirs. Targets for those products are the same as the ones that they already had, so seamless is not an exaggeration. Okay, so they think next year is going to be the year. I thought this year was going to be the year, but like maybe the epidemics kind of just rolled things back. We'll see. Okay, completed. Same. So branded extended release. These guys they're almost at 50%. 85 million in synergies. That's awesome. So these guys got out. Well, they had 27 of these guys. I hate to say that was all bull, but I mean, it sucks that they got roped into that. Like I've said before, these guys are trying to be the solution to that opioid issue, and they really weren't on the market when that was the real main primary cogwheel or culprit to the opioid epidemic, which pharmaceutical drugs being abused and the overprescription, doctors just getting incentivized to hand out that stuff all the time and fill in prescriptions for pretty easy, which could have been alleviated with some NSAIDs. So these guys are trying to be the answer, and they still kind of got blamed just because, by guilty by association, really. So a little bit of a bump. Things look like they're a little bit better. A little bit better in terms of revenues, but a little bit more in terms of expenses. Sorry, less than expenses. So a slight move up, potentially. Slight move down, potentially. Slight move up. So they're doing great. Nice work. All right. Anything we can get from this? That's good. So that's good. That's a good sign. So if they're getting the stuff they just brought in and they're doing better with it, good. I wish these guys had more cash. I'm happy with it. They're growing their cash position, but I wish these guys had a lot more. There's a lot of great targets out there that these guys could scoop up. But they probably don't want to deal into the critical care stuff. But, man, these guys they've been doing such a great job that I wish they were capable of handling. I shouldn't say I don't know if they can, but it'd be nice to see these guys handle a larger portfolio, even bigger. But I don't think they're commercial. It would be a stretch. I don't think they commercially could handle it. They'd have to really expand their. Actually, I shouldn't know. I'm not saying they can. They should, but I just like how these guys run things. They've just done a really great job. I wish they could take some of the stuff that's just being lost to terrible management and in other companies. These guys could do something great with it. All right, so not really anything else from these slides, but let's take a look at the chart now. Here we are, daily chart. So again, this is where my buy threshold is, and this is where our sell target is. I'm going to have to figure out I have to sit down and really grind it out, but in general, I think we're just going to have to bump it up probably. Yeah, probably bump it up to close to 14. Huh. Okay, that's May. Saying May was closed to 14, but then... Oh, yeah. That's interesting. Saying the low was at 13 there. But on the monthly, on this chart, it's saying the low was 14. Well, regardless, I'm thinking of actually moving it up to 14. If we get another shot at it. Might have to do 15. Even 16 probably. I don't like moving it up that much from 12 to like 14 or 15. But the company's better. I haven't really adjusted this since the BDSI acquisition. So, although that hurts them obviously from the media acquisition, taking the money out, but the guys are already growing. They're growing that already, so we have to adjust. So I'm gonna have to move it up, probably close to 15. I'll go with probably 15 and change. I'll figure out what with the valuation. I'll do that later, but I'll move that up. I'll probably keep the sell targets fine. That's still, I think those are fine. We'll keep those. But the whole point of this is what happens when the company is like just this low key improving. They're slowly getting better, and not only getting better, but their competition's eroding. So it's just not a brand name that people know. And I was expecting that underfollowed State would have gave us a nice shot at getting a discount. You know, I put 1276 thinking that was like, hey, we can probably, start get an initial position going, and then really get something around $9 was when I was like, yeah, that's where we can pull the trigger on something bigger and then hold it for a while, take some profits in the 20s. But I think it's maybe not amongst retail traders, but institutions, these funds are probably looking at Collegium and seeing how they're just slowly growing their market share. They're almost at 50% of the extended release branded market. And they're doing their contracts, they're getting negotiations, they're winning those. So once that happens, I don't want to say it's guaranteed money, but I don't suspect these guys are going to fall off anytime soon. And despite the issues of being an opioid company, these guys are the answer to it. Because they're, like I said, they're the ones that are trying to do the right thing with opioids. Ethical leaders. Anyway, we're going to leave it there for Collegium and move on to Dynavax. So Dynavax Technologies is the next on our weekend review. DVAX. Do this sucker real quick. Now Dynavax, I've gone to this one a few times. Look at that. Very nice. Clean. Look at that. Now Dynavax was I don't have the monthly up on this one, do I? Nope. Dynavax I used for a great example of when to take profits from a video very long time ago. But it was a time where I basically hit the sell button on the right day. And I haven't really done much with it. Another one that hasn't hit our buy target. I thought we would get a good shot at it, but it's not going to happen. We're going to have to make an adjustment, probably. I don't think, unless the overall market rolls over. In that case, it doesn't really matter, but I hate not being so far outside our buy threshold. I'm going to have to make an adjustment here. And not because we got to get in, but these guys are still making solid money from their COVID vaccine adjuvant, the adjuvant that they have that is being used in multiple COVID vaccines. Not only that, but the HEPLISAV-B, or their hepatitis B vaccine, is gaining traction. So even if the opioid epidemic goes away and nobody's using those companies' vaccines, these guys are still growing with their own product as completely separate from COVID. So let's go to those guys. Let's look at their products. So here's HEPLISAV-B, 2-dose hepatitis B vaccine. The only 2-dose, everybody else is 3. Did a great job in the clinic, but it took a while for this to really get grip. And now they're really got grip and they're accelerating. So let's go to just go to that. Come on, jumping all over the place here. So they're up 65% year over year. And this is the adjuvant that they have that's being used in COVID vaccines. That's up because those guys finally got, most of the companies they're working with finally got through regulatory. So these guys are pulling at 550 mil to 600. Like I said, this a long time ago, I said this was my favorite COVID vaccine company. Because they're not making their own. They just literally took their adjuvant, which is really good, which is, what their whole platform's based on. And so that instead of them trying to produce it, they just handed it out. I shouldn't say they licensed it to other companies around the world, and they're using it. And those are some of the best vaccines in the countries that they're being that were developed and approved in. So it's working. Great. Now they also, there's another big one. Second consecutive year of profitability. So this company was burning cash. HEPLISAV-B was slowly gaining traction, but not enough to outpace the cash burn yet. And now with COVID and getting their adjuvant out, plus it gave them some time, stop the cash burn. And now they can accelerate HEPLISAV-B. And it's working. So anyway, this is what I would look for. Dynavax is advancing pipeline different product candidates to leverage. So that's good because hey, it's worked before. It's working in COVID-19 vaccines. How do we take this adjuvant and we just get rid of? Because I know they were going to do, they had this. I know pertussis was the first thing that they were, but the Tdap vaccine, that hasn't really been updated in, jeez, I don't think they've updated that at all. I'll have to go look back, but that's something like the hepatitis B vaccine was the first thing they went after. That hasn't been updated yet. Good to see that they're going to go after that. Shingles vaccine, there's Shingrix, which that was GSK with Genesis Pharmaceuticals, their adjuvant, which is a good one. But I think Dynavax going after it themselves might be a little bit better. We'll see. And they're going after the plague. I mean, it shows up. There's issues with the plague. So we gotta do something about it. And it looks like, yeah, U.S. Department of Defense. Let's go take a look at that. Here we go. This is the list that we want to look at. These are the guys using the adjuvant. Now, this is big because look at what we got here. We got 3 different types of vaccines that are using this adjuvant. That's something to say. So it's not just one type of vaccine. So if any vaccine developers are out there and they want to, make their vaccine a little more potent, I'm sure they're considering looking at the number of that have worked and how it's worked. They're considering calling up Dynavax. Nice. So that'll be interesting to see what we got there. And the plague. Nice work. I'm laughing because I remember, like, pre-COVID, the shorts loved just, I hate to say they were memeing on Dynavax because they weren't, but just this pure amount of, Dynavax sucks and companies just burning through cash and no one cares about 2-dose vaccines and they'll never overcome the Merck and GSK vaccines and stuff like that. Now look. They dunked on them twice. Vaccines, the Heplisav B is working, and their adjuvant is being used in numerous vaccines for COVID, and they're also moving on to 3 different other vaccines. And because it's using, I'm not worried about them proving that it's better now. I'm sure they can probably come up with, better vaccines that are out there right now. The adjuvant's in there, and these guys know how to do it. And they have the product to do it with. So let's go back. What do I do now? Just like we just had a discussion with Collegium, hasn't hit. Do we pull the trigger here? It's getting above that 200-day EMA. It has a little bit of a gap. Might have some issues at 14, but then all of a sudden we're going to be hitting sell targets real quick. I might have to make it $12. Bringing the buy target up to $12. The whole, it's almost twice. Yeah. Guess we're stuck with that. That's fine. If the market does sell off, we could just, hold off until we see a nice reversal setup before we hit it again. But I don't think there's anything stopping Dynavax fundamentally right now. Even if COVID-19 starts to fade, the Heplisat B should just keep driving them higher. And hopefully by then they'll have at least one or two other vaccines getting close to phase 2, 3. And if one of those really hits and looks great and it's going to outperform the current, that should help keep the premium in the share price long enough until that hits the market. Go from there. All right, so let's go on to NantHealth. All right, next on the weekend review is NantHealth. Now, this is someone reached out, like what's going on? Why, what are we going to do about this penny stock? Why is it just falling apart? Well, the fundamentals aren't great right now in terms of like cash burn and earn. These guys are pulling in cash. They are seeing top line growth, but let's actually get to their earnings. If I can find NantHealth. Do we have NantHealth? I'll have to go. We're still... Yeah, here we go. NantHealth. Let's see what we got here. So this is a healthcare technology. Let's quickly get to their earnings. Investors. So, 16 mil. So 16.6 up from 14.4. Oh, let's see versus so that's 20 this year versus Q3 of last year. So up 2.2, but then unfortunately we got R&D expenses rising, and we also have SG&A. So the burn is outpacing the earn, so that's the issue, and that's why we're grinding. So they're going to need a solid inflection to essentially offset that. I still believe that any Nant company has the pedigree to be a good company. You can call me a Patrick Soon-Shiong fanboy, whatever, but the guy knows how to run companies, get to profitability, and make good business decisions. Not everything's perfect. The guy's got plenty of things in play, and I'm sure he's had several, failures. But these guys are growing. It's just, it's an expensive, it's a tech company. So these guys are going to cruise through cash, but hopefully at the end, when they get the acceleration's so hard away from the burn that, quickly becomes profitable. Yeah, these guys just not too much to talk about here. But that basically just puts it, their data solutions kind of connecting the payers, providers, giving them the analytics to help them make decisions, etc. I'll probably have to do a deep dive into this one day, but the question really was about what do we do? And it's a lot of hold tight here. I haven't really pulled the trigger. The valuation is probably absurd at this point. $42 million. No one's even covering this company. Like, hello? Does no one believe in this? Well, it might be the new Nant Quest, which is no one cares about it, the market destroys it, and then it's slowly just grinding its way higher in terms of the company making progress. It bases out for almost a year, which it hasn't based out yet, but one could argue that it being around sub $1 for slowly just grinding around. I mean, no, there's not even short interest on this thing. It's just no one wants to touch it because they're just burning through cash. 16 mil. They're not really accelerating growth. So I still long term I'm liking it. I'm just staying away from it until these guys get above 16 million. 14, 16 million. These guys got to get to basically double that. And I'm not seeing it right now, so I'm still keeping it into the portfolio because it's long term, and when it starts to show growth, you'll probably see a solid snapback here. I would argue it's undervalued for what it can be. So once they start seeing some inflection for like 2 quarters, you might see it's like it's just they have to figure out a way to patch it up. They got no cash, so gotta stick away. I mean, they got debt and it's an issue. So stay away from NantHealth for the moment until somebody fix something. I hate to say it's probably not going to be acquired. If anything, it just gets absorbed into another Nant company at this point, if it's worth anything. He might use it just like he used Nant Quest to bring something else onto the onto the market, some sort of reverse merger situation. All right, I'll end it there for the weekend. I know there's a few different names going on here, but NantHealth are staying away until we see something change. Got to see a change in the earnings or a major update. Dynavax, I have to adjust. I'm probably going to move it up to around $12 for the buy threshold. And then Collegium, I'm moving probably up to around $15 per share. So we can finally get involved with those names. Thanks for listening. Good luck. Stay healthy. And I'll have the weekend report probably tomorrow evening.